She's an ophthalmologist in Dubai. Doctor, what inspired you to pursue a career in medicine, and how did you overcome any initial challenges or doubts?
Hello, Dr. Thaumani, nice meeting you, and thank you for the nice question it was. Actually, it was not a complete choice from my side to do medicine. I was more passionate towards doing engineering. So when I got 4 seats in engineering and 1 seat in medicine, all the engineering colleges were outside of Chennai. So medicine was the only one which was available within Chennai, and my father's choice was that I stay with him. So I decided to do medicine only because it was my father's choice, and it was within Chennai. So it was actually, I should have landed up, I had decided in my life that I will do BE Chemical Engineering at Anna University and work for BITS Pilani, Baba Atomic Research Center. But everything changed, and I absolutely have no regrets for having taken this field.
How did you take up ophthalmology, doctor?
That again was by chance. This time I will attribute it to my mother. I wanted to do anesthesia, so when I went for my medical counseling for the post-graduation, I told my mom and my sister was waiting outside that I'm going to go and choose anesthesia. But when I went inside, I was offered the list of courses available and the colleges and the universities, but I don't know what slip of tongue I had there. I said ophthalmology, and when they announced, those days they used to announce in the Director of Medical Education that so-and-so has been allotted this seat in this college. So when it was announced, my mom and my sister were sitting outside, were surprised to know as to why on earth did I choose ophthalmology, because nowhere it was there on my list. Again, no looking backs. One particular thing which I have learned in life is, when you get into something, don't go back. Give your full contribution, give your full hard work, and keep moving, because it's only going to be a waste of time again going back and restarting from the first step.
That's great, doctor. Doctor, can you share a particularly memorable patient interaction that has left a lasting impact on you? How did it influence your approach to healthcare?
Of course, definitely there are many such patients. One such patient whom I can definitely recall.
They say kan kudutha devam. That is, God gave me the eyes. To an ophthalmologist, that's what say. God gave me the eyes. Like, you are treated as God who gave the vision.
Exactly. So I'm basically from a very, very, very middle class family. The only thing that was there in the forefront for my parents was to get us educated. So every bit of their income was put in only for our studies, nothing else other than that. So when I got into ophthalmology after completing my first year, so it was only 2-year degree course. I was doing my diploma in ophthalmology. So at the end of first year, I realized that I'm getting into a field where I will have to invest a lot of money to start my practice. I was very clear that I'm going to start my practice, but another 1 year only more to go. And that is when I realized that after 2 years, after getting my degree, how am I going to start my practice? When am I going to start my investment? All that funding, where will I get? So it was a big question. So I finally convinced my mother that I'm going to stop ophthalmology. So at the end of first year, though I was university first in the first year, I decided that I will quit ophthalmology. So I convinced my mother with great difficulty. I went to the RMO's office in Egmore Eye Hospital, and when I went there, fortunately or unfortunately, RMO's office was closed that particular time, sir was not available. And when I was just coming back, I met one patient by name Miss Rani Ammal. I still recall, because not a single day goes without remembering that patient. So I had operated her, and she was the first patient for whom I had implanted intraocular lens, because those days we used to do more of FAK cataract surgeries also. So this patient did not have money for paying for the intraocular lens, so I paid her money from my pocket and I did the surgery. Her vision was so good. She's basically from a village. So when I was coming back from RMO's office, she was waiting there for me with one big pack in her, and she was so happy and elated to see me there. She gave me what she was having in hand, and when I opened it, it was some newspaper with a lot of handmade savories, and she has come all the way from village to show her eyes to me and thank me. So I decided that I should not go back in ophthalmology. So this was somewhere in 1998. So from then on, I knew that there is something destined for me, and maybe there are many more patients for whom I'm committed. So again, no looking back. So there are several instances in life where I could have turned back, but something kept me moving forward.
That's really great, Doctor. Doctor, both your children are doing so well in their studies. You are taking care of your parents. You are so loving with the family. How do you balance your profession as well as your personal life, Doctor?
It's sometimes quite draining, but the thing is that we will have to reach. It's only after all one life that we get to live, and I always live by the motto, and that is what I've transferred to the children also, that we should not just live. Don't just live. Leave footprints and leave a legacy. So in this one life that we've got, which many of them will really crave for, especially having been born in a beautiful family with good people around, we should try to make the best use of this life and lift ourselves as well as lift others. So I make sure that there's a certain destination that we have to reach, and give the best try for it. Same thing I say to my children also. So be into a lot of activities. As you grow, lift others also around you.
That's really great, Doctor. Doctor, have you been involved in any medical mission or outreach programs? Can you share a story that highlights the challenges and rewards of serving the underserved communities?
Yeah, very much. I'm a part of several medical camps since my first year in MBBS. I've been associated with Lions Blood Bank almost from 1991 December. My father passed away in November, and I got Lions Club scholarship in December. So from then on, I've been every month attending their medical camps, eye screening camps, their blood donation camps and all that, almost for more than a decade. And then after moving to UAE, here also we've been doing a lot of voluntary organizations and being a part of a lot of social activities. And in 2015, I along with my other family members started a program called Gift of Sight. That's when I was working in Dubai municipality, and we used to have a lot of these needy workers, laborers coming to have their eyes tested. I used to prescribe them glasses, do a proper testing and give them glasses, but after a year or two they will again come back without the glasses. So that's when I questioned them that I am giving you the glasses prescription, but why is it that you people don't make glasses? So they said that they were finding it very hard to even buy the frames and make glasses in spite of slogging everything. So vision is something which everybody has a right, so it cannot be denied. So we always used to have, all of us used to have some frames lying at home. So that's when I and my family members decided that we will start collecting the unused frames. So since 2015 beginning, we've been collecting the frames which we have at home as well as from the neighbors and other community members, and we've been reaching out to the needy people through authorized agents, and we've been meeting the laborers and giving away the free spectacle frames so that they can just go to their home country, or here only they can change over. At least a part of their expenditure is saved.
Doctor, one last question. What advice would you offer to young aspiring doctors to become doctor, especially who might face doubts or discouragement along with the way?
See, we have chosen this profession with some reason in mind. So very rare, one or two people like me only would have been put into it, but still I did it with passion. So I always feel that the commitment and dedication should be there, especially in a profession like medical, where we are responsible for someone's life. We should show utter dedication. So don't do it just for the sake of a degree or just for the sake of coming up in life. We should do it with utmost passion. There are certain professions only like medical and teachers where you will be able to have a lot of gratification. Self-gratification also will be there. So when you treat a patient also gets better, and we also get instant happiness. So this should keep driving the doctors in future.
Thank you, Doctor. Thank you so much.
Thank you, Dr. Kaur.